Understanding knee pain and recovery.
Knee pain is a common issue, often caused by injury, overuse, or underlying conditions like arthritis. Effective rehabilitation can speed up healing, improve mobility, and reduce discomfort. At-home routines are a practical way to support recovery. Always consult a healthcare professional before starting new exercises, especially following injury or surgery.
Early stage rehab, gentle motion and stretching.
Start with gentle range of motion exercises to maintain flexibility. Try seated knee bends. Sit on a chair. Slowly slide your foot back and forth, keeping motion pain-free. Gentle hamstring stretches, lying on your back, and using a towel to pull your leg up can help loosen stiff muscles. Avoid pushing into sharp pain and focus on smooth movements.
Building strength, key at-home exercises.
Strengthening the muscles around your knee is vital for recovery. Begin with straight leg raises, lying down, tighten your thigh, and lift your leg. Wall slides, where you gently squat against a wall, can build support. Resistance bands add intensity as your knee improves. Always prioritize proper form and increase activity gradually.
Balance and functional training.
Balance exercises retrain your knee for daily tasks. Stand on one leg, holding on to a stable surface for support. Try gentle step-ups onto a low platform. As you gain confidence, add dynamic moves like side steps. These routines help restore stability and prevent future injury, preparing your knee for more challenging activities.
Tips for success and when to seek help.
Be consistent with your rehab routine. Ice and elevate your knee after exercise if it feels sore. Gradually return to normal activities as pain allows. Watch for signs such as persistent swelling, inability to bear weight, or locking sensations. These warrant professional evaluation. Recovery takes time, so listen to your body and progress at your own pace.